Howdy guys, and welcome to today's Let's Talk About Poop podcast, where every Monday I go live on my social media streams and also do our podcast to answer your questions you guys have about your gut health. If you're looking for ways to optimize your gut health from a Mayo Clinic trained gastroenterologist, that it actually gives you evidence that you can take and understand, this podcast is for you. So in today's video, we're going to do a deep dive on a condition I see commonly in my practice called gastroparesis or delayed gastric emptying. We'll discuss what are the causes of it, what are the symptoms, how do we diagnose it, what are the treatment options I recommend. We'll go over the most common questions you guys have on this particular topic as well. And then on the later half of today's podcast, we'll discuss some other questions you guys have asked, including why do I burp so much, reasons why you're nauseated, and recommendations I have. And if you're watching the live stream, we'll discuss any questions you guys have as well. So if you're joining for the first time, I'm Dr. Islam. I'm a board-certified gastroenterologist. I'm trained at the Mayo Clinic of over 10 years of treating individuals with all sorts of GI issues. Our approach is try to get down to the natural cause of why you're having your GI issues. I don't want to just give you a pill for your ill. I want to find out the root cause and maybe offer a more natural approach if we can to hopefully get your symptoms taken care of. We'll discuss that in more detail in this week's podcast. Hope you guys are having a great week so far. So I'm very happy because my Longhorns are ranked number 1 on the college football, standings. I'm a diehard Longhorn, but I also have a lot of PTSD when it comes to Longhorn football because I know how we are. I know there are times when we actually don't do as well or we have all the hype. And so I'm hoping that will last and become, the champions. It'd be great. Second announcement is that if you've been seeing my stories on my social media feed, we are doing a health challenge. I want to encourage you to come join us as well. So every week we have a new challenge we're trying to do. Last week we talked about our recommendations for 5,000 steps, 64 ounces of water, doing some exercise, and going for walking. And so join us every day throughout pretty much for the whole month of September, October, and even up to November, where I'll give you a daily and a weekly health challenge. So today's health challenge was to get 7,000 steps, still drink at least 64 ounces of water, but we're going to focus on our mental health as well. So I discussed in my stories what I've done to help out with my mental health. Let me know in the comments down below what you guys have done, but also let me know in the comments down below if you guys are joining us on our health challenge as well. And I would encourage you guys to join us and at least follow us on our social media channels so we can talk about exactly what we're doing, but also what we can do to hopefully help out when it comes to your health. I have found that working as a group is the best thing when it comes to getting the goals that we want, also getting us feeling better as well. So I look forward to seeing you guys on that as well. All right. So today's topic, gastroparesis. Let's talk about this. What exactly is going on? What do we know? What do we talk about? What do you need to know? So what exactly is gastroparesis? So in essence, it is delayed gastric emptying. This is when your stomach does not want to work as well as it should, and you actually have difficulty with digestion of certain foods. And so if you feel like you're just not always digesting your foods, or if you feel like that you're not able to get the foods that you want, or you're having some symptoms in the upper GI tract like nausea, vomiting, abdominal pain, it actually may be related to what's called gastroparesis or delayed gastric emptying. So what are the symptoms of this? How do you know if you have this? Well, there are a couple of cardinal symptoms that we have. The most common one is postprandial nausea and vomiting. This is the biggest one. And so it typically occurs after you eat. So whenever you normally eat food, the food goes from your mouth, your esophagus to your stomach, and then will get digested down to its lowest particles to go into the small intestine, get absorbed, then eventually will go into your colon to be expelled. When you have delayed gastric emptying or gastroparesis, the food does not want to leave the stomach. It just sits there and sits there and sits there. And when food sits there for a long time, you get the symptoms of nausea and vomiting specifically after you eat. And so I say specifically because we try to determine the time frame of when you have nausea and vomiting, because nausea and vomiting is one of those symptoms that is so multifactorial. It is due to hundreds of different reasons, and not all the reasons are related to the GI tract. We also determine timing as well, because nausea that you have all the time is not gastroparesis, or nausea that you have immediately after you eat is not gastroparesis, and nausea that you have days after you eat is not gastroparesis. So when it comes to gastroparesis, because it's a stomach issue, it is postprandial after you eat, and occurs within minutes to hours of nausea and vomiting. But it's not the only symptom that's there. You can also have epigastric pain, fullness, bloating, And also, too, you can have constipation as well. So if your stomach is slowed down, there's an excellent chance that other parts of your gut are going to be slowed down as well, including the small intestine and the colon, which can cause constipation, bloating, distension, feeling like you're pregnant all the time. These are other reasons why you can have the other symptoms you can have with gastroparesis. Other symptoms include poor appetite, getting fuller quicker and more often, worsening acid reflux and heartburn as well. And for some individuals who have diabetes, their blood sugars can fluctuate because they're not able to absorb as much food as they normally can in a consistent pattern. So these are the clinical clues that I use as a GI doctor to see, all right, I think this person has gastroparesis. So let me see what's going on. So what do we do to help diagnose somebody with gastroparesis? Well, one of the first things we want to see is to make sure there's no blockage to cause gastroparesis. So when I ask medical students, you have somebody coming into your clinic who's coming in for postprandial nausea and vomiting. They have early satiety, they're getting full quicker, they're unable to digest. What is the best next step in the management of that patient? Well, the first thing we have to do is we actually have to take a look and see anatomically, is there a blockage that's there in the stomach? Because by definition for gastroparesis, there's not a blockage that's there. So what are the things that can cause a blockage in the stomach? And also, for example, so if you have an ulcer in your stomach or in your small intestine, that thickening of that ulcer can make it more difficult for things to pass through, which will cause symptoms similar to gastroparesis. Number two is a big old cancer, unfortunately, a gastric mass. So if you have a mass in your stomach, absolutely, you're going to get postprandial nausea and vomiting because that mass is taking up room. So the first thing that we do is that we have to rule out some sort of anatomical obstruction that's there. And the best way for us to do this is do what's called an upper endoscopy or an EGD. So basically we go down, we use a small little camera. I take a look inside that stomach to see, is there an anatomical reason why you're having these symptoms? Is there a blockage that's there? Is there a mass that's there? Is there some sort of obstruction I can see with an upper scope? If that is normal or negative, then we do what's called a gastric emptying study, where we see how long it takes for food to leave your stomach. Now, there are a couple of important things you need to be aware for this, because a lot of physicians and clinicians, unfortunately, order the wrong tests. And I don't want you to be diagnosed unfairly or wrongly with gastroparesis if the test is not accurate. So a couple things you have to be aware of. So number one, we do a solid food test for 4 hours. It needs to be a 4-hour test. And in most individuals, at least 90% of your food should have left the stomach in 4 hours. But in those with gastroparesis, because it's not moving, you'll actually have retained food in your stomach even after 4 hours. Now, the important thing is that it must be a 4-hour test. I've seen in the past other healthcare providers have ordered a 90-minute study, which is not accurate. And so I have patients who have come to see me who have this diagnosis of gastroparesis. They actually don't have it because they actually had the wrong test, which wrongly diagnosed them with gastroparesis. It was not the accurate 4-hour test in which you eat radio-labeled eggs, and we just see how long it takes for those eggs to leave your stomach. So that's how we diagnose. If you have those two things, a normal EGD and an abnormal 4-hour gastric emptying study test, then you have your diagnosis of gastroparesis. So the question is why? Why do you have gastroparesis? What are the causes? Well, a common cause is diabetes. Diabetes or sugars affect everywhere in your body. Your eyes. It can affect your teeth. It can affect your feet. It can also affect your stomach as well. And that diabetes can actually cause you to slow down in your stomach. Now, commonly, we see this in diabetics who have other medical diabetic problems. So a common question that we see that I talk to medical students about is you have somebody coming in who has a history of diabetes. Their hemoglobin A1C is out of whack. It's like 14. They have neuropathy. Their nerves are out of whack. They have issues with their kidneys. They're on dialysis because of their diabetes. They have high blood pressure. What do you think the cause is for this individual's gastroparesis? And it can be diabetes, and it's commonly a common cause for people who have gastroparesis. Another one is surgery. Surgery, especially maybe some sort of upper GI surgery or a reflux surgery, you can cut what's called the vagus nerve, and that can also cause gastroparesis to occur. The vagus nerve is a nerve that innervates the GI tract that gets stimulated in periods of rest and digest. And so if you cut the vagus nerve, you actually prevent the contraction of your gut, and this can cause symptoms of gastroparesis. Number 3 are medications. There are certain medications that are notorious to slow down the gut. So things like opiates, opiate painkillers like Loratab and medications like that commonly can slow down the gut, slow down the stomach, and slow down the colon and cause gastroparesis and also cause constipation, reflux, and other worsening symptoms like that as well. Next can be a viral infection. You may have some sort of viral gastroenteritis and also commonly can cause gastroparesis to occur as well. And so that can be another reason why you have gastroparesis. Sometimes you have a neurological issue like Parkinson's disease or multiple sclerosis. These conditions can also affect the nerve lining of your gut to cause symptoms of gastroparesis. Sometimes it can be autoimmune related as well. You can have autoimmune diseases that can affect the gut to cause gastroparesis. And then lastly, but probably one of the most common, is idiopathic. We don't know why you have gastroparesis. And this, unfortunately, is a very common cause of why individuals have gastroparesis. This is why they may have. We just don't know why that's the case. But at least in some individuals, we can piece together the reason why you may have gastroparesis and what is going on there. So now that we've diagnosed you with gastroparesis, we did an EGD that was negative. We did a 4-hour gastric emptying study that came back that it was delayed. What is the best next step in the management of our patients with gastroparesis? Well, the first line of treatment that we try to do for all patients is lifestyle changes. So changing your diet does play an effective role to help manage gastroparesis. So what we tell patients, and what I tell patients, is you want small, frequent meals all throughout the day, low fiber and low fat. Now, this sounds contrary to everything else I've spoken about when it comes to your gut health, but what we have found is fiber and fat will stay in your stomach longer and more often to make gastroparesis symptoms worse. So you want to minimize the fiber and you want to minimize the fat as well. But not only that, you want to change how you eat, the pattern of how you eat. So instead of eating 3 large meals per day, I tell my patients I want you to be grazing throughout the day. 5 to 7 meals per day is what I want. Small, frequent, and foods that are low in fiber, low in fat. That's going to help out. Sometimes you may need pureed foods or liquid foods as supplementation or protein shakes. That is fine as well, as long as you can get the caloric intake that you need to hopefully get you feeling better. I also tell patients to avoid carbonated drinks because keep in mind that carbonation will stay in your stomach longer to cause worsening pain, distension, bloating, and reflux symptoms as well. Now, in some individuals, doing lifestyle changes like this will make a difference. But for others, we actually do need some medical therapy. So we have a couple of medications that are there. We have some that are on label, FDA approved. We have some that are off label as well. So one of the ones that are FDA approved is called Reglan or metoclopramide. This is a medication that very commonly can be used to help out with the contraction of the stomach to allow things to move through a lot easier. Now, it does not necessarily always help out with the nausea, though it can. It does have some anti-nausea effects, but it does help out with the contraction of the gut. And the idea with using a medication like metoclopramide is that you're stimulating the stomach to move things along into the small intestine. Luckily, metoclopramide has an anti-nausea effect as well that we can use and help out with when it comes to nausea. Now, there are side effects with any medications, and metoclopramide or Reglan has side effects as well. The biggest one is called tardive dyskinesia. This is involuntary twitching of the mouth. This is an uncommon occurrence, but of all the symptoms that occur, this is one that can be there, and it can be pretty scary to have this. So this typically occurs when you take metoclopramide for a long term, for high doses, and you don't stop. And this is why the FDA approval to use metoclopramide is only for 12 weeks. And so sometimes we tell our patients, take it for 12 weeks, consider taking a break, and then maybe consider getting back on it as well. And for some patients who use the medication, it does help out with the contraction, also helps out with the anti-nausea effect as well. Now, what I typically recommend is that we will warn them obviously about the side effects, but also too, we just want to consider taking a break after a couple of months to see if we can get it out of your system. But in the right patient, it does work really, really well to help out with their symptoms. Now, another predominant symptom when it comes to gastroparesis is nausea and vomiting. And this may be the reason why you're wanting to see us as well. And so sometimes in addition to giving metoclopramide or Reglan, we can also treat you with anti-nausea medications as well. So whether it's Zofran, Phenergan, or other medications that we use to help out with nausea, we may use this in conjunction with metoclopramide to help give you the best effect to manage your symptoms and get you feeling better as well. Now, there are a couple of off-label medications which I won't talk about right now. We have some other options besides medical therapy. Sometimes we consider what's called a gastric simulator. Now, the gastric simulator, it's an okay device. Basically, what it is, like a pacemaker that you put on the stomach and helps kind of pace the stomach. The data for this is okay. It doesn't seem to work great. It tends to really work the best in those who have diabetes as the main cause for this, and also tends to work mainly for symptoms of nausea and vomiting. But once again, it's not the best option when it comes to treatment. Sometimes we can also do an endoscopic procedure called a GPOEM, which stands for gastroperoral endoscopic myotomy, which in essence, what you're doing is that you're going down with a scope, you're actually cutting the muscle that we think could be contributing to what's going on to the gastroparesis. What we think is going on is some individuals, the muscle called the pylorus, which is at the very end, which connects between the stomach and the small intestine, may be too tight, contracting too much. Sometimes cutting that muscle can relax it. Right now, there are currently clinical studies just to see if this option can be helpful for our patients with gastroparesis. So we don't currently have this as an approved treatment, but it may be a consideration for those individuals in the right setting and also in the right clinical case as well. Now, obviously, what we also want to do is to try to minimize the triggers for gastroparesis. So if you have diabetes, you need to get that better controlled. If you're on opiates, you need to maybe get off opiates. If you're on pain medication, you need to get off that. But if you can do this, it will help out. And in some individuals, this may not be enough. They're still losing a lot of weight, having nausea and vomiting. And so sometimes giving them an access for feeding may be the best option to hopefully get you feeling better and hopefully controlling your symptoms as well. But this is kind of the deep dive that I give to my patients who have gastroparesis in terms of how we diagnose it, how do we treat them, what are the symptoms, and what can we do to get things taken care of for you. Now, going to a couple different questions. Number one, is gastroparesis a chronic condition or can it be cured? So it's kind of, this is a little bit of a hit or miss question because it can be cured if we can find the cause, potentially. So if you have bad diabetes, I've had patients who got their diabetes well controlled, who were able to have normal gut activity and get your gastroparesis taken care of. I have other patients who are on opiates who stopped it, got off of it, and their gastroparesis was taken care of. But I have others in which it's the same thing. They have diabetes, their diabetes is well controlled, but they still have residual effects from their gastroparesis. And keep in mind, the most common cause of gastroparesis is idiopathic. So if it's idiopathic, that's something unfortunately we cannot fix because we don't know the cause for that when it comes to those issues. So that's the issue when it comes to gastroparesis. Number two, what are some long-term consequences of gastroparesis? Well, the biggest one is just malnutrition. And that's the thing we worry about the most is that it's if you're vomiting so much, you can't get anything down. It is such a difficult thing for our patients who have gastroparesis to live with because you're just miserable all the time. You have the nausea, you have the pain, you also have the vomiting as well. And so we have to make sure that you can maintain adequate nutritional support when it comes to having those issues that can occur with that. Now, if you have concerns about gastroparesis, I would encourage you to share this video. If you know of a friend, use that video. I have a lot of videos on this as well. But also, too, if you have issues with gastroparesis, come see us. We take care of this. We know what's going on. We can hopefully get things taken care of for you and resolve those issues. All right, perfect. Awesome, guys. So let me go through some of the social media streams. So I want to thank you guys for watching on today's on TikTok and on my social media streams. Let me take a look here and see anybody have any questions here on TikTok. Perfect. Sounds good. Thank you for watching so far. And then on my other social media streams. So a question was asked, is taking thiamine B1 and magnesium for stomach problems a good idea? So that's a good question. And I'll tell you, we don't have a lot of good evidence that taking B1 makes a difference when it comes to stomach issues. So I don't really have an opinion on that. Magnesium, we don't have a lot of good evidence that it can help out with stomach issues, except for the fact that there is some evidence it can help you relax. So if it does help you relax and you feel better, well, then there you go. But in terms of direct effect on your stomach, we don't have a lot of good evidence for that. Now, we do have some evidence that using magnesium can help out with constipation. And so sometimes we use magnesium oxide or magnesium citrate to help out when it comes to bowel issues. Two caveats with that. Number one, you have to be careful of those individuals who have kidney issues And number 2, you also have to check for individuals to make sure you're not taking too much magnesium, which can cause long-term consequences down the road by taking too much of that. So just be careful of that. All right, next topic. Hey, Dr. Islam, I burp so much. What is going on? So let's talk about this. We'll talk about exactly what does it mean when you burp too much. We'll discuss what is normal, what is abnormal. We'll discuss some of the causes. I'll talk about what treatments I recommend. And at the very end, I'll talk about when you need to see a doctor when it comes to burping and what is going on. So let's talk about burping. Is it normal? And the answer is yes. It is perfectly fine to burp. And I don't want you to worry that you're burping, because it's part of the normal process. What happens when you burp is that you have too much air in your stomach. And you have air in your stomach, only has 2 ways to go because it has to get out. One is that it can be expelled out as a fart, or 2 is it can be burped out as a burp. And that's basically the physiology of this. So what is considered abnormal? Well, you determine what is abnormal. There is no clear definition medically of what is considered abnormal when it comes to burping. Meaning, if you have a lot of discomfort, you have a lot of distension, it's affecting your day-to-day activities, that for me would be considered abnormal. I have a lot of patients who burp all the time. They don't care. It's not a big deal. And I have other patients who burp a lot, and it is concerning for them. It is a big deal. It is something worrisome for them, something worrisome for them as well. So what are some reasons why you can burp so much? Let's talk about that. One reason is acid reflux. Absolutely, acid reflux or heartburn, that could be a sign of burping too much. And this may be your only sign. And this is very normal. You may not have even typical symptoms of acid reflux. You may just have burping. And you'd be surprised how many patients we treat their acid reflux and their burping goes away. And that's one of the first things that we do. Number 2 is drinking things that can cause burping. So you guys know what it is. The carbonated drinks, carbonated water, alcohol, beer. These things have bubbles in them. And if you're going to ingest more bubbles, you're going to have a lot of gas that's there. Number 3 can be food intolerances. Certain foods don't digest well in your stomach. And if they don't digest well, they cause bloating to occur. So these include things like dairy, lactose, sometimes egg, gluten, grains. And so it's very individualistic to determine if you have those particular foods that are known to cause a lot of gas and bloating to occur. Next to me, just swallowing a lot of air. You're a sloppy eater. A lot of us, including myself, we're trained to eat so quickly, just putting food down, that we don't realize we're actually ingesting more air than we should. And just the simple fact of just ingesting more air will cause more air to go into your belly, cause a lot more bloating to occur. Next thing is you can actually have an inflammation in your stomach called gastritis. Now, I have a lot of videos on gastritis, but gastritis basically is inflammation of the stomach for many different reasons: alcohol, medications, infections. And so if you have gastritis, that can also present with bloating as well. Next is that we have a condition called rumination syndrome. And this can also be a reason why. So what rumination syndrome is that it's called effortless regurgitation. Food goes down and comes right back up within seconds. So you eat it and it comes right back up. And sometimes people can manifest that as burping as well. So keep that in mind. And then lastly, small intestinal bacterial overgrowth, or SIBO. SIBO is when you have too much bad bacteria in the small intestine. And that can cause fermentation to occur, produce a lot of gas, and that gas can also produce burping as well. Some have artificial sweeteners in them, and these commonly are a reason why you have food intolerance, so try to minimize or eliminate chewing gum. Number 2 is, obviously I mentioned before, drinking carbonated beverages. If you're going to drink a drink that's going to cause gas in your stomach, of course you're going to have more gas that comes out because of the bloating that occurs. So make sure you can eliminate or minimize those carbonated drinks. Number 3, eating too quickly. I'm guilty of this. It's just the way it is sometimes. But sometimes just slowing down when you eat can make a big difference in terms of getting you feel better, but also managing the gas that's occurring as well. Next is using a straw. That's sucking in of the air when you use a straw. That also can cause a lot of gas to occur. And so simply avoiding a straw whenever you're drinking may help out when it comes to bloating as well. Sometimes we use over-the-counter treatments like Beano or Gas-X or activated charcoal. They work effectively, and they can hopefully minimize the bloating that's going on there as well. And then lastly, treat the underlying issue. If you have bad bacteria, we'll treat that. If you have gastritis, we'll treat that. If you have an infection, we'll treat that. If you have GERD, we'll treat that. But this is the approach that I recommend when it comes to treating burping to hopefully get you taken care of. Now, even though burping is common, When should you see a doctor about your burping? Couple things. Number one, if you're burping, it just gets worse. So I'll tell you a story. I had a patient of mine that had a lot of burping, but it got to the point in time where this individual was burping all the time. She could not stop burping. It was interfering with her quality of life. It got worse and worse and worse. We were able to find out why, and we took care of it, but it just got worse and worse and worse. So if you notice that the burping is getting worse or affecting your quality of life, come see us to find out what's going on. Number two, you have sudden vomiting with that. All of a sudden, you're just vomiting all the time with the burping. Well, my concern is that there's an obstruction going on. We need to find out what that is and hopefully get that taken care of for you. And number three, you have severe abdominal pain. You should not be having severe pain with bloating and burping. That is not normal. So if you have that pain, make sure you come see us. We can investigate what's going on and hopefully do a deep dive to get things taken care of for you. This is my approach when it comes to burping. This is my approach when it comes to bloating. Let me know in the comments down below what you think. What have you done? What have you tried? What's worked? What hasn't worked? I know my audience will love to hear you guys as well. All right. Perfect. All right. So going through some of the social media questions here. So a question on TikTok I got. GERD treatment if you have disaccharidase deficiency. So what exactly, good question. So what exactly is that disaccharidase deficiency? So there is a condition called CSID, congenital sucrase isomaltase deficiency. Now we've seen this in kids for a long time, but now we're seeing this in adults. And typically we're seeing this in individuals who have IBS-D diarrhea that's not completely controlled with the traditional treatments, including dietary options and medical options. So what we realize is there are certain carbohydrates and starches that we cannot absorb because we lost the enzymes to absorb them. This includes things like dairy, for example. And so by losing those enzymes, you can manifest as symptoms of bloating, distension, and diarrhea. Now, you treat this by two ways. You either avoid those foods that we know you cannot digest, or we give you digestive enzymes to replenish them so you can eat whatever you want. And that's how we treat this. Now, this is different from GERD. GERD is heartburn or regurgitation. The treatment's both very, very different. So you absolutely can treat GERD and treat it differently than you could with CSID or disaccharidase deficiency. And that includes lifestyle changes, acid-reducing medication, dietary changes. And so the treatment is very different for one versus the other. So just because you have one does not mean you can't have the other, and does not mean you cannot treat up both as well. Great question that was asked on TikTok. Great question. All right, perfect. All right, next topic, nausea. So in this one, I'm going to give you 7 tips I recommend to get rid of nausea, and I'll give you 6 reasons why you need to see a doctor about your nausea. So tip number 1, actually going for a stroll outside. I cannot tell you how therapeutic it is for nausea and other GI issues just to simply go outside and go for a stroll. The physical act of going outside will help out with your gut microbiome and help out with kind of moving things along, help out with your mental stress, and also help to kind of allow things to digest easier and to be more gentler on your stomach. So going for a stroll is one of the first things I recommend when it comes to nausea. Number 2, I've used peppermint and ginger all the time when it comes to nausea. Peppermint, you can use peppermint capsules or a released peppermint called IB Guard. Works great. Mint tea is fine as well. Also, I recommend ginger. Ginger's been around for centuries when it comes to nausea, and it works. And ginger is a very effective anti-nausea medication to get you feeling better. Whether it's ginger root or ginger tea, whatever you can, ginger works. Number 3, acupuncture. So if you have nausea, there's good evidence that acupuncture can help out with that. And sometimes for those individuals that have severe nausea, I do recommend that because it does work. The evidence seems to be there. Number 4, make sure you're well hydrated. So if you're having nausea, you're not eating, you're not drinking, and you are at risk of developing dehydration. So what I recommend is have small amounts of water, small sips all throughout the day to help out to make sure you're not dehydrated, to keep everything down. Next is you want to change your diet. Small, frequent meals are the best thing whenever you have nausea, especially meals that are low in fat and low in fiber, and just spread it out through the day. I would recommend for you to graze throughout the day more than anything else, because this will allow you to eat on a more in a better way, so you're not having as much nausea and vomiting that can occur with that. And then next, number 6, When you're choosing a meal, choose a light meal to have, because having a light meal is going to be better for you. So no sauce, no order, no spices. This is making things easier for you, for your gut as well. And then lastly, you want to have foods that can maybe absorb excess stomach acid. So things like plain dry biscuits actually work fantastic. They act like a rock, like a sponge, to hopefully allow you to not have the nausea and to hopefully allow you to resolve those symptoms as well. You also want to avoid citrus foods and spicy foods as well. Now that I talked about 7 ways to prevent nausea, here are 6 things to worry about when you have nausea. So number 1, the nausea does not get better, it gets worse. You're just having nausea all the time to the point where you just don't feel good. Number 2, you have severe vomiting associated with that. So nausea and vomiting that occurs can be a sign of multiple different things, but if that occurs, you need to make sure you get some help or find out what's going on. Number 3, you have severe dehydration from the nausea and also the vomiting. You're just having nausea so much that you can't keep anything down, and because of that, you're dehydrated, you don't feel very good. Number 4, you have severe abdominal pain. Pain with nausea is a sign that something not good is happening inside your gut. Whether it's an obstruction or whether it's a something that's growing inside your gut, you need to make sure we can find out what's going on. Number 5, you start to not have any bowel movements. When I have somebody come to see me for nausea and vomiting and they don't have any more bowel movements, I'll worry about a couple of things. Number 1, are you getting enough nutrition in to allow you to have a bowel movement? But also, is there an obstruction going on as well that could be making things worse? And then lastly, if you have nausea and vomiting, you vomit up blood as well. Don't think that vomiting blood is normal. It's not. It needs to be investigated so you can find out what's going on, treat that, and get things taken care of for you as well. This is kind of my approach when it comes to nausea. Tell about some of the gut issues that people may be having as well. All right, perfect. All right, let's talk about, so another question here. What can be done to help treat diverticulitis? And what is the difference between that and diverticulosis? All right, this is a good question because I get this question all the time. So diverticulosis are outpouchings in the colon. Very common to have. About 40% of the U.S. population has diverticulosis, which are the outpouchings that's there. Very common to have, not a big deal. If you have this, I would not worry about this at all. We have no evidence that avoiding things like seeds, nuts, popcorn, things like that are going to make a difference for diverticulosis and make it worse. This is different from diverticulitis. Now, diverticulitis is actually inflammation of the colon, and we typically cannot see this during colonoscopy. Now, we can see diverticulosis during a colonoscopy and not diverticulitis. This is active inflammation that's there. And this will typically present with left lower quadrant pain, fever, chills, and sometimes some bleeding as well. The way we diagnose this is with a CAT scan, which we can see actually inflammation in that area, most commonly in what's called the sigmoid colon, which is the most common location of diverticulosis and diverticulitis. And the way we treat that is we treat that with antibiotics. We give antibiotics to hopefully calm things down so we can make sure everything is doing okay. So once again, diverticulosis is normal, part of the normal anatomy. You don't treat it all. Versus diverticulitis is inflammation in those pockets. We do treat it, and you diagnose this with a CAT scan. I hope this clarified that distinguishing factor because it's very common for a lot of my patients to be confused if they have one versus the other. All right, perfect. All right, guys. Well, I think that's what we got today. Let me just make sure nothing else is on. Perfect. I want to thank you for watching. If you like what you see, if you like what you hear, give us a 5-star review, download our podcast. If you like what you see, don't forget to subscribe to my channel. And if you're having any gut issues, come see us up at Gastro. We can find out what's going on and do a deep dive to get down to the root cause of why you're having your gut issues. And thank you for watching. I'll see you guys on next week's podcast and video.